I'm sure it's crossed your mind at some point whether the medication that you're currently taking or thinking about taking is safe while trying to conceive. I'm Nurse Heather with Premom, and today we're going to chat about those medications that you should avoid while trying to conceive and those that are safe alternatives. So let's just dive right in and talk about pain management, something that we could really all use medication for from time to time for various reasons. The main medication that you want to avoid while trying to conceive are non-steroidal anti-inflammatory drugs, also known as NSAIDs. In women, these can delay or inhibit ovulation, which is essential when trying to conceive. And in men, these can alter sperm count, sperm motility, and sperm morphology, the way that sperm look. So you really want to avoid these. These include medications like ibuprofen, naproxen, and aspirin. A safe alternative to these is Tylenol or acetaminophen. This is not an anti-inflammatory drug and is the safest option for pain management while trying to conceive. You don't want to use this drug every day, just when you really need it. Opioids are another alternative for pain management, but studies have shown that in men and women, they do show decreased fertility. So it's really advisable to only use these when you absolutely need them if possible. They also have been shown to decrease libido, which is not exactly something that's desirable while trying to conceive. Another ailment most people experience to some extent is allergies. Antihistamines such as Benadryl, Zyrtec, Claritin, Allegra, any of those are generally safe while trying to conceive. However, you do want to avoid them around ovulation time because they dry up secretions. We want secretions because that's what gives us that fertile cervical mucus. We want this because it creates that perfect environment for traveling sperm. So how do you know if you're close to ovulation? Using ovulation predictor kits, also known as OPKs. These measure the luteinizing hormone, also known as LH, in your urine. As you approach that fertile window where your LH increases, this is what tells your body to release that egg. So as you reach that LH peak, the highest level that triggers ovulation, you can assume you'll most likely ovulate within the next 24 to 36 hours. So by using these ovulation tests, you can predict ovulation before it happens, allowing you to avoid using those antihistamines unless absolutely necessary. And along with allergies comes stuffy nose, cough, cold, especially during flu season. So using expectorants such as Mucinex or cough syrup can really help ease these symptoms. And I'm sure that you've heard by now the myth that these expectorants can increase fertility by thinning cervical mucus and increasing it the same way that it thins secretions in the lungs to ease these symptoms. However, there have been multiple studies that have never been able to prove this, but these medications are perfectly safe while trying to conceive. Medications you do want to avoid are Robitussin, Dayquil, NyQuil, and Sudafed. All of these medications contain ingredients that are potentially harmful to a fetus. So definitely avoid these while trying to conceive, just in case you are pregnant. And then an easy way to track your cervical mucus is by using the Premom app. There's also an entire list of other ovulation symptoms on there as well that can help you know if you are close to your fertile window and you're approaching ovulation. Now that we've talked about medication to avoid while trying to conceive, let's talk about one that we do want to ensure we're taking every day, and that is a prenatal vitamin. We want to choose one that has choline and at least 400 micrograms of methylated folate. DHA is also super essential because this helps our baby's neurodevelopment. So we want to take this as a separate fish oil supplement, including at least 200 milligrams, but really ideally 600 milligrams. Iron can also be taken as an additional supplement because all of our iron needs are so unique. So you want to ensure you're taking this prenatal because it builds the foundation for your baby's future home. If you're interested in learning more about what exactly to look for in a prenatal vitamin and these supplements, check out this video. Also, the Premom app is wonderful for helping you keep track of taking your prenatal vitamin every day. You can log it in the app and even set a reminder to tell you, hey, take your prenatal vitamin. Just remember that anytime you are taking a new medication or you have questions about whether it may affect your fertility, always feel free to reach out to your doctor. And if you're ever unsure about a particular medication, never hesitate to ask. Thank you so much for hanging out with me today. I'm Nurse Heather from Premom. Good luck and baby dust.